Hello everyone, my name is Omar Dewidar and I'm working with Dr. Vivian Welsh at Nutrition International to investigate the effectiveness of nutrition counseling for pregnant women in low middle income countries. So nutrition counseling has been hypothesized to improve the health and nutritional status of pregnant women, but little is known about the impact of such interventions that might carry on maternal and neonatal health in individuals residing in developing countries. So we decided to conduct a systematic review to assess the effectiveness of nutrition counseling programs in low middle income countries. So for our review, we searched 5 databases since the date of their conception with an applied low middle income country filter published in 2012, which was the latest. And this filter was designed by the EPOC group. And we wanted to capture studies that included pregnant women between the ages of 15 to 49 in different stages of gestation, and they had to reside in low middle income countries as defined by the World Bank. So our primary comparison was nutrition counseling versus usual care, and it was mainly to assess maternal health and behavior as well as neonatal health. We included studies that were randomized control trials, non-randomized control trials, quasi-randomized control before and after, and interrupted time series conforming to the EPOC study design group. So we considered nutrition counseling as a two-way interactive communication linked to promoting behavior change and provides opportunities for participants to identify and assess barriers, improving their nutrition, and down the line identifying their goals. And this could happen via one-to-one sessions or group counseling. And we hypothesized from that this nutrition would lead to an increase in knowledge of nutrition-related information in accordance to international practice guidelines, and in the process women will gain awareness of the importance of their prenatal and postpartum diet. And from that, this would lead to an increase in motivation and an increase in adherence to nutrition counseling sessions. And from in the short term, that would improve the behavioral outcomes, and in long term, improve maternal behavioral and health outcomes, as well as the neonatal health outcomes. And we are well aware that individual and household level factors may mediate the effectiveness of the intervention as well as the suggested outcomes along the causal pathway. So our comprehensive search yielded 9 studies that met our eligibility criteria. 6 of those were included in the quantitative analysis because 3 of the 9 were abstracts. And from the outcomes that we were able to meta-analyze was incidence of stillbirth, and this was defined as death or loss of a baby before or during delivery, but before the baby was born. This outcome was assessed in 2 randomized control trials, and the pool estimate suggested a non-significant benefit associated with nutrition counseling. Now, the 2 other outcomes, perinatal mortality rate and percentage of women with low infant birth after delivery, were also assessed by those 2 studies, and they both also suggested a non-significant benefit for the women in the nutrition counseling group. And and there is very little heterogeneity between the studies. We found limited evidence for the following list of outcomes that we also intended to assess. That means there was individual studies across the different study designs, and that was and it's inappropriate for us to pull them all together. But there was studies for anemia, hemorrhage, and others as well. But we couldn't find any evidence for maternal mortality, maternal iron deficiency, mode of delivery, intent to breastfeed, and initiation of breastfeeding. It is important to keep in mind that the randomized controlled trials that were used for the meta-analysis were of poor methodological quality and high risk of bias. So we acknowledge our limitation that we used a search filter, and that restricted our search to trials conducted in low middle income countries, which really deems our findings as preliminary. We are currently we removed the filter and we rerun the search and identified 60 new studies that are currently in the extraction phase. But depending on what we have so far, there is very limited evidence for the benefit of interactive nutrition counselling on child and maternal health. Thank you.